Everyone. Thank you for joining me for today's informative briefing. Today, we're going to be discussing some upcoming changes to our medical supply. So, come the new year, we're going to be changing, especially our point of care testing. And in having to change our point of care testing, this has caused us to change our medical supplier as well. So, today we'll go over reasoning why, what my role is going to be in this, and how it affects everyone. And I'll leave room for any questions or comments, concerns. So, just briefly, just to go through this here, reasons why we're changing, mainly three. One being cost. Cost is a factor in this uncertain time. And two, product availability. That is still a concern. We all can remember the uncertain feelings that we experienced during the pandemic when there were times that we didn't have the proper PPE to do our job safely. We don't want to experience that again. And three, as an organization, we're trying to lower our waste. If we lower our waste, in turn, that would help with our first reason, which is we're trying to conserve and be financially smart. So the people that this is going to affect, this change will affect providers, all of the clinical support staff. With that being said, we also encourage the administrative staff to be abreast of the changes so that they can assist with any patient questions that may arise. And again, we discussed the reasoning why we're having to change the supplier. Another factor that we believe is going to help the organization financially is the fact that some of these newer manufacturers have extended expiration dates. That's another reason to go for this change, because if you have a product longer, in the long run, it's going to save you money. So that's another factor. The changes will take effect in the new year, and in my role, I will ensure that all clinical labs across all of our locations are fully stocked, meeting the quality control standards so that we can perform our jobs safely and effectively. And regarding safety, that is one thing the organization will not compromise on. We want to make sure that we have the right products, the safest products, to make sure that everyone around us, patients, employees, everyone is doing their jobs properly and effectively with the right products. So I will also be placing weekly orders, just ensuring that we do have the supply that we need to perform our duties daily. And it's essential not to, again, be left behind without supply. So, as Henricks explained in the NIH Medical Device and Equipment Purchasing, more comprehensively known as procurement, the supplier and healthcare provider require consideration for the user needs, technical maintenance, training needs, and adequate consumables and how they can be disposed of. Again, that all relates to waste and how we want to do our part so that we're not pushing out waste and again, spending unnecessarily. So, in closing, our main concerns are safety for all, limiting our waste as an organization, and then the ultimate goal, too, obviously, is to be financially smart. And as mentioned in the AMA journal, in addition to generating a significant amount of waste, the healthcare sector directly emits an estimated 7% of the United States greenhouse gases. Again, going back to waste, we want to do our part. And I do understand that change can cause some anxiety, and we often feel like it's a challenge when things get changed up and we get accustomed to using the same supply. But I do believe that these newer products, again, longer expiration dates, the outcome in all areas is going to benefit the greater good. I do believe that. And again, I will be here throughout this new change. I will be here for training, one-on-one. I can schedule with the manufacturer to come in If you learn better as a group, we can also set that up. But again, I will be here along the way to help everyone so that we can all perform our jobs safely and we feel confident in the products that we use. I thank you for your time and I welcome any questions, concerns, feedback, and plan for more education to come.